Here for 2 seconds and flip these slides this way. All right. For those of you who aren't in the room with us, welcome. My name's Lee Patterson, and I'm joined by Dr. Lou-Ann Lawson. We are presenting a session today on how do you create your own teaching philosophy and what you might do with it. I am the chair of emergency medicine at East Carolina University, and I have a background in residency education and faculty development. And Dr. Lawson is the senior associate dean at VCU in Richmond, Virginia, and has a background in curriculum design and clerkship running. And we have no disclosures. I will share with all of you, if you're looking at us real time, we made some adjustments to our slides, and they should hit the app as adjusted and updated later on today. We're going to be talking about the utility of a teaching philosophy for an early career educator. Talk about 5 key elements that need to be in your teaching philosophy, and the 5 orientations kind of briefly of adult educators. We'll talk about utilizing a teaching philosophy to guide your early career, but then also how do you take that outline, write it, and perhaps use it for promotion and advancement. At this point in time, I think we're going to stop and have a little bit of a small group discussion based on the attendance in our room right here. And our first question we're sort of contemplating for folks is, why do you teach? Welcome, come on in.
As I was walking by all the rooms, was really
Yes.
definitely not you or your description.
That is all right. Welcome. If it looks like we're being a little formal, apparently we're being recorded, and so we're going to share our discussion, but we are going to try to modify for a little bit more of a small group discussion to join us. But the question we're sort of asking people to think about is, what motivates you to teach? Why do you get up and go teach? And I will tell you that if you look at our colleagues in education who focus on adult education, there are 2 big reasons why people teach. They either want to help individuals change, or they want to help society or some type of institution change. There are 2 large umbrellas for that. Within those 2 umbrellas, there are really 5 philosophical orientations that kind of fit into those 2 sections. And the way I like to describe these to people is to think about driver's ed instructors, people teaching 16-year-olds how to drive cars. So imagine for a minute, we've got a cluster of folks who showed up to be sent out to teach driver's ed. At the bottom of the list, behaviorist, and we're all familiar, I think, with a lot of behaviorist philosophies, perhaps psychology, but a adult educator who's got a behaviorist orientation really believes they can change society by engineering the educational practice. So a driver's ed teacher like that gets up to teach because if he teaches people to drive in the exact same way every time, then we're going to have a safer set of roads. Conversely, somebody who has a radical philosophy of education gets up in the morning to teach to disrupt society because that's going to benefit society as a whole long term to change it. So this is the person who's going to teach people to drive who shouldn't be driving, or maybe who society has decided shouldn't be driving, but driving is going to be a tool for disruption, so they're going to get up and do it that way. When we think about the folks who are really oriented to individual learners, we think about first people with a liberal philosophy. And it may surprise you, but those are people who are highly motivated by the content. This is the driver's ed instructor who thinks driving is the single coolest thing you could possibly do, and who wouldn't want to drive, and why wouldn't I want to help you know the best thing I know how to do, which is how to drive. These are folks you sometimes see in medicine who are absolutely motivated by their content, their area. They were born to be a nephrologist or a pediatrician, or just that content really motivates them. Humanists, who have educators who have a bit more of a humanist leaning, are very, very focused on the individual and a lot less on what it is they teach and how they teach. This is the driver's ed instructor who says, you decided you want to drive? I'll help you drive. This is what you want to do. I'm going to help you be your best person. Without oversimplifying it, you might find a lot of people in medicine with this leaning or focus in student affairs, in admissions, in foundational areas of curriculum, really talking about individual development and focus. People with a progressive leaning or progressive outlook on life are people who are motivated to teach in order to help adults solve problems. That driver's ed instructor says, driving is a key part of navigating a host of problems adults face in life. I've got to help you do that. Let me help you figure out how to do that. It's a little bit of a rough definition of each of those, but everybody who teaches adults, and in case you weren't sure, we do. All of our learners are adults, everybody from medical students to senior faculty. They're adults in some way. We have at least two of these leanings. And when we think about writing our philosophy of education, our philosophy of who and why we teach, we begin there. So what we thought we'd give everybody a chance to do for just a second, if you want to grab your cell phone and take a look at this QR code, it'll take you to something called the Philosophy of Adult Education Inventory. And what this is an automated test. It'll take you probably 3-4 minutes, maybe a little bit longer to walk through, but it's a series of questions that if you answer right now, you'll get a picture of what experts in adult education would assess to be your motivations, okay? And you'll typically find you have 2 of the 5 I mentioned in that space. So we'll take a minute and pause right there. That's a great question. So that is a great question. There are no good or bad philosophies. Yes. What I will say, and I'll give you all a minute over there to finish, but...
I'm not radical. And you know what, when you went through that, I'm like, oh, I'm not.
So that is one thing that we want to say. Well, that is not a bad philosophy. There are very few people in health professions education who endorse that philosophy, which makes a lot of sense because we are rule-bound. No, but we're very rule-bound. We're very, rule-bound or guideline-bound or evidence-based, very structured. You can imagine that doesn't fit very well with the philosophy we would see in healthcare. In other areas of higher ed, it's quite prevalent, but not medicine, anywhere in medicine or health sciences, you don't really see that much.
Even if you think about just how you get into medical school, like you follow very stringent guidelines, you do what people tell you to do, you advise, you shadow, you do volunteer experiences. Like it is all very sort of cookbook up until that point. I mean, if you look even up until the past sort of probably 30-ish years, people were largely science majors, which probably even made it more so of that way. So I think, it just from the very beginning, we are probably recruiting people that are not of that philosophy.
Because I do hear, oh gosh, I don't know, I want to record it.
That's all right.
My comment is a little, so sometimes I hear genuine faculty saying, oh, we need to disrupt things, or I think ED doctors and primary care doctors both have some ADHD, which is the opposite of what you're saying. So they have fitted that mold, but there's other aspects to their character where they're not going to be the three-piece suite,
And I think it isn't necessarily a complete definition of who you are, but really that motivation. Why do you come to work? To teach people? Not why do you learn? Not why, there's not a motivation of you as a learner, but what motivates you to teach other people? And for most of us, we're going to identify with 2 of them. Maybe a primary and a secondary are going to sort of fit with us.
It's fascinating. And actually, my primary role is not a teacher. That's why I wanted to come, because I want to learn to
But we all teach in some capacity, whether we're teaching lab technicians or other faculty. Yes.
And as I've become more so I have a lot of research funding, so I'm seen as a successful researcher. So they come to me, they want to learn the ways, and so I need to learn to be a better teacher. And as you get older, you really want to mentor, right?
Right.
It's more important.
You absolutely do, and mentorship is teaching the same. Absolutely.
It's very
Does it surprise you that behaviorist is something that you see when you take that.
So tell me again what the behavior
Sure.
is.
So, and I think it's easy to get confused because there's behavioral psychology, there is behaviorist philosophy, there are also behaviorist techniques. So I will tell you, simulation is a behaviorist technique. And a behaviorist would engineer the environment to drive the same outcome every time. So education is, the motivation there is, can I help generate the same outcome every time? It's not exactly the same as people who teach procedures, but a lot of people recognize that because teaching procedures, high-risk, structured skills that have to be done the same way every time, lend themselves to behaviorist techniques. But this is a person who says, hey, I am motivated to help get the same thing every time. It doesn't necessarily surprise me when you say, I do a lot of research that's very outcomes focused. There's a lot of structure to that. You want to see people generate good research. You want it to be quality and come out the same way every time. That may be some of that, but it doesn't mean you don't like people. So sometimes people get confused about that they say, hey, I like my learners. I focus on my learners too. It's not about that. It's sort of what motivates you to do that.
But the scientific method doesn't change. The method you follow to do science, have a research question, have methods, collect results, analyze your results, have a discussion. That's a basic thing that often for physicians, they don't get it. They haven't fully, so that's what I teach, and that is the same. So I get why I would come up as a behaviorist, because often I'm fighting them that you have this, you can't come at it from a different direction. It's not the scientific method. Now, results can change over the years, and of course, because if you use the method properly, it's always open to new data coming in, and new interpretation, and new results. So it doesn't mean that science is fixed, but the method is fixed.
Yeah.
Quick question. So I have a tie between humanistic, one second. I have a tie between progressive and behavioral. Is that a common?
So I don't know that there is a lot of, there's research you can look at and see what are common ties and common links in them. What we know very clearly, like I said earlier, is that we do not have many radicals amongst us in education in that space. I will tell you the two of us identify very strongly in the progressive realm, quite a bit of problem solving, that notion of helping people solve problems. I think there are many people in medicine who do have true behaviorist leanings or motivations with that, but it gets confused. And then there are other people who don't, but maybe they do a number of things or they teach skills in which they frequently use behaviorist techniques, frequently use very structured behaviorist techniques, but that may not be the motivation they teach.
And just a follow-up question. So once that I have identified my education philosophy, how do I use that to
What do we
as
do
like
with
a
that
med
next?
student, design a curriculum or teach my MS1s?
Absolutely. What do we do with that
Before
next?
we
Sure.
even go, are there any other surprises for anyone that you're like, I'm blown away that?
You are contemplating very hard right there.
I'm surprised the test is so long.
Oh, certainly. Yes.
It is a long test, and this is one of the few tests that I feel like sometimes changes based on what I was just teaching. So we were having this discussion last night a little bit about the behaviorist piece. And I know one of the first times I took this, I had just been planning and revising a simulation curriculum. And I think I scored a lot higher on the behavior side than when I'm thinking about, okay, what is the predominance of what I teach and why do I teach? And what's that underlying as opposed to sort of trying to think of a specific thing that I'm teaching.
Right.
Because I think my approach when I'm teaching my fellows, which have a different topic, is different than when I'm teaching at the bedside to a resident, which is different than when I'm teaching on education day.
Right. And I think sort of going back to what you said, this is really the what motivates you to teach, like taking all of those things away and yet recognizing that we're using very different techniques based on what we're teaching at the moment.
Right.
That those are really more sort of skills and strategies as opposed to the philosophy of what drives us to teach.
And to your point about the length of sort of the assessment or the inventory, this was created by Dr. Lorraine Zinn. So other places you'll find it in the literature referred to as a Zinn, Z-I-N-N inventory. She studied adult educators, and the model that you see online, you can find wonderful, I have articles and some citations at the end for people who are interested in looking at it, but for many years, she had the portal open, and adult educators would do exactly what you're doing, and they were analyzing some of those results. But it is a sizable inventory to take a look at.
Well, I guess it's thorough, and it's a bit like finding out your Myers-Briggs or something.
Yes. Again, it is that underlying motivation. So what do you do with that when you sort of begin to say, well, why is it that I get out of bed to be a teacher? Why did I choose to teach as opposed to something else? The next part we recommend people thinking about when they're thinking about what is my comprehensive philosophy of being an educator is to consider 5 key questions. Those are sort of who do I teach? And we're going to drill down into each of these in a minute, but who do I teach? What exactly do I teach? How do I teach it? Where do I teach it? Which is a bigger question than you think. You've already begun to describe several of those settings. And then what do I think about my teaching? And as we go through those questions, that last question incorporates a bit of a reflection on this is my motivation. This is my motivation. So the handout each of you has is really just a worksheet to work through these 5 questions. And at the end, if you've really given some thought to those answers and drilling down into them, you're beginning to get to what a philosophy would be if you were writing it for yourself to look at, or if you were writing it for guidelines for promotion and advancement. So I would love to ask people who they teach first. Who do you teach now? Who did you teach at the beginning? Let me ask that. Who did you first teach when you first realized, hey, I'm officially teaching, or I believe I'm teaching in some shape or form, any role? Who'd you teach?
So before med school,
That's right.
in my life after med school, before med school, I was an adjunct professor at a women's liberal arts college, so I taught micro to pre-nursing students.
Okay.
So that was a really fun experience, and I do miss that part.
Awesome. Undergrads. Wonderful. Women undergrads. Specifically headed into health sciences.
Specifically headed into
Nursing. Yeah. So drill down all the way. Who'd you teach?
So my first life was teaching science. So I have a PhD in chemistry, and I taught similar chemistry to undergrads. And then my second life is being a primary care researcher. So I teach research to residents, and I also have a team. So I guess I mentor and teach my team in the arts of being research coordinators, managers, all of that.
And if you think about your team, who are they? Where on a spectrum of learners are they? Are they undergrads, grad students, postdocs?
Mostly grad students. I've had high school kids that are phenomenal, and sometimes they're the best people to teach because they're so grateful for the opportunity, and they can be amazingly talented, and they're going places, and that's been wonderful when I've crossed paths with a few people like that, yeah.
Okay.
So I guess mostly graduate level, but
Okay.
yeah.
Anybody else? First learners and who you're teaching now?
Yeah, so I've always been teaching emergency medicine residents, which is probably common among these folks. But I also teach informatics fellows, and it's interesting that and it really changes my motivation, because I'm trying to get my informatics fellows to be disruptors, and but I also understand the basic science, and so I'm the basic science of informatics is what I'm saying, and so it's interesting that I really want to change things, And I think that's what motivates me a lot. And so maybe I'm not as motivated. It just makes me kind of ask myself how motivated I am or am not about the education, because those guys could probably just read a book and maybe get it.
The residents?
Yeah, I don't know. I don't know. I'm sort of struggling sometimes,
That's all right.
feeling the dichotomy between the two.
Let me ask you, do you teach all residents? Do you teach all residents similarly? Do you have a section of residents or a time in their residency that you gravitate towards sharing information or working with?
The truth is, I do prefer the interns who really need a framework for their thinking.
Yeah.
And the senior residents, I find I enjoy telling them a little bit more about, asking them, how does this fit in your framework? Or what do you think of using this decision tool? And so I guess I like that, but I think it's a little bit more interesting to start with the fresh slate person who just has no idea what's going on with chest pain, and you just be like, all right, this is how you think about this. And I at least feel like I give them a structure to think. So maybe I do I think.
So those are professional students
Yeah.
in that early phase of their professional development,
Yeah.
and they're in that foundation phase. So residents, they're not medical students.
Uh-huh.
I'm sure you work with them too,
Yeah, a
when they're in
little
that
bit less,
space.
a lot
Yeah.
less, yeah.
Yeah, but if there's a group of residents you prefer to, or a group of learners you picked,
Mm-hmm.
that's kind of where you begin to think when you're describing this. So if you were writing this up for someone else of who am I and what do I teach, I hear you talking a lot about informatics fellows and interns, and
Yeah.
sort of let me help you build the foundation, and then another group of learners you're working with that help perhaps disrupt or support that foundation.
Yeah.
But it's a drill down really very deep. It's not, I teach medical students or I teach residents, but really who are you targeting? You teach family medicine residents to research, kind of thing. Yeah,
Did you have a chance to say, what did you score on?
yeah.
Oh, well, my two highest were progressive
Mhm.
and behavioralist or
Mhm.
behaviorist.
Makes a lot of sense. Yeah.
Just here, you talk a lot about, even though you're talking about disruption, you're really talking a lot about
Problems.
solving. You want to help them
Yeah.
develop a framework to solve problems. And I think that's one of the things, we were talking about radical is the idea that the radical philosophy is a little different. I think in emergency medicine, we tend to be early adopters, so I do think we want to change things. I don't know that we want to completely blow up the world in any way necessarily a lot of the times with that, but we want to early adopt with that. And so I don't know if you all have read the book Disruptive Innovation, and it's really, and I think that's where emergency medicine physicians are really good, is taking the opportunity and creating opportunities to, taking that sort of situation and creating an opportunity to change things along the way. I mean, COVID is a good example of this. We took what we were dealt, which was not ideal. And then ultimately, we really changed some practices because of that. I mean, now as part of our ED follow-up process, we actually have telehealth visits that we follow up, and we never would have done that. And so we could have just gone back and done things the way that we did. And so, I think there are some ways that we can use that as the lens and kind of move things forward.
I guess that's so interesting what you're saying, because COVID was such a time of disruption, and so many good things have come out of it that we've hung on to, right? That made sense, and so much of the virtual outreach and things that, that's just impossible to figure out how to have patients, consent virtually, and then we do it all the time. Of course it wasn't impossible, but we used to have that thought. So the rule structure can be very constraining if you're not careful, and it needs a disruptive event like COVID to shape the real rules. People drive me nuts,
We're really rule bound. I think There are a couple of other questions that maybe, the two in the middle, I think are probably a little bit easier to think about on reflection. If you're thinking about who you are, I will say the last thing I would add, and as you're reflecting on and thinking about cataloging who you teach, is also to think about how did you come to teach them. So if we're really fleshing this out for a reflection for submission, what group of learners that you began with, and then what group of learners do you work with now? Targeted learners, preferred learners, where much of your energy goes. How did you come to teach that new group is a great thing to also include under that first question. But the next two questions, oh, I'm sorry.
Well, I was just going to say, who actually really selected
Their
the
first.
first group of learners that you really wanted to teach?
Or did you get assigned?
Yeah, I feel like I got assigned to doing it, but my true love is actually research, and I must admit, often I just want the teaching to go by as fast as possible. And has anyone heard of FOFO? It's a teaching method, but it stands for fuck off and lie down.
Sure, yes.
So you give them some guidelines, and then you tell them to go away, because a lot of research is like read some examples and then come back.
See, and you and me, we would call that self-directed learning.
Yes. We highly recommend you put that in your teaching philosophy. Use that term. I think one of the points that you're getting at is that for many junior faculty, if you're working with junior faculty, they got assigned. You are going to teach this unit, this section, go precept these students. And then as they matured, they maybe migrated to, or the idea was their own and they were able to select that. And so when we're reflecting on this and writing that document, that's a beautiful piece of that. I began with this, and many very successful people went and solved the problem they were dispatched to solve in education, right? But then what did you get to do? I suspect you didn't begin with informatics fellows. You didn't begin teaching MS1s. You grew into that role, and how did that happen is a great reflection for that first question.
And how do you get away from your own learning style, which is definitely the FOFO?
Yeah.
I did most of my learning
That's a
myself,
great-
and I'm amazed at how needy some people seem to be, you know.
Sure. I will tell you what we did was go back to school, and went back to school in the College of Education to get some help about that. How do I move past that? The other thing I would recommend is doing an exercise we didn't include here today, which is taking an assessment on your own learning philosophy. Why do you learn? It is very different, can be very different than why you teach. So I will briefly share with you an example that always makes Luann laugh. I have a very eclectic learning style. I think anything and everything is interesting. I don't teach that way. I teach very much to a problem-solving approach and philosophy, but I'll read anything, I'll learn anything. I think anything's crazy. I took a year chairing the Department of Pathology and thought it was fascinating. It was like a junior year abroad for me as a 45-year-old woman. But that's not why I teach. And sometimes sitting down and examining that and looking at the difference can be very helpful to say, okay, this is me as a learner, and I have more than one identity. And beginning to develop that. This process a little bit is how you might develop it, to think about it. I think the next two questions, sort of what do I teach and where do I teach, might get a little bit of reflection to what you're talking about. How many of you could discreetly describe what you teach? What do you teach those first-year residents? What do you teach the informatics fellows?
I don't want to say it wrong. I know what I would have said.
Sure.
It's hard
Yeah,
to
there's
say
no
to
wrong.
the
It's
teacher.
okay.
So, well, to the informatics fellows, I teach concepts of information.
Mm-hmm.
I think that's a good general way to say it.
Sure.
And then I teach them, I give them a lot of practical experiences. I make them go and do things and talk to people and create projects and write up.
What does it mean, the informatics? Are they ED doctors?
Yeah, they're ED doctors who then spend 2 years doing information systems work, and they get board certified.
Really?
Yeah, so it's like a subspecialty, just like EMS or any of these other ones. And so I do that. Let's see, and then with the interns, I think I realistically, I teach them algorithms. Like when it really comes down to it,
Sure.
I teach them algorithms for patient care, and I teach them how important to weigh different findings
So in
and
both
how
of,
they impact disease.
so in both of those groups, you're teaching content or pieces of knowledge, specific content items,
Yeah.
but you're also teaching skills. Those skills are not motor skills, not how to do a central line, although you probably do some of that too, but you're focused a lot on the cognitive skill development. So you teach both content and skills, and then you can really describe those, the content that you're teaching. That's a lot of what you would put in there, but if you're talking again to that broader audience, I teach people content, and then I use that content, especially with your informatics fellows, to teach them the skill of solving a new problem or growing and developing and working with that electronic record in some way. Where do you teach your learners?
I'm very boring, just like in a classroom.
Sure, that's okay. That's one of the sites.
But do you? Because you just said you had a lab team. And so how do you teach
That's
them?
True, and I mean, I teach faculty if you look at it from that point of view. But there's more I think of that more as mentoring than teaching, I guess.
That's right.
I don't know. You can make those divisions.
So you described working with interns on shift. I suspect, so at the bedside would also be in that clinical space, would be in it. I think the point, again, thinking discreetly where all of those areas are. There are many areas you could be teaching. The large classroom is one of them, small group, labs, a host of labs, simulation lab, the actual wet lab that you might be in, the computer lab. Are you teaching in that site where you're having them do things? Mentoring one-on-one is absolutely teaching, absolutely. And it doesn't matter, I think, for this purpose of thinking about your identity as an educator, and perhaps writing that narrative to advocate your identity as an educator to a promoting body, you don't need to draw that line. I put that in there.
Yeah, that's interesting, because I'm forgetting a whole thing. I'm faculty on a K-12 program, so those are junior doctors, sometimes senior doctors who decided to switch towards research. And with them, I think of my own experiences, and research is full of totally horrible, bleak moments in your career where you believe that you have horrible, imposter syndrome, and you think you've got no skills, and your idea is terrible. And I actually spent a lot of time coaching them around those thoughts, because nobody helped me through that. Somehow I struggled through anyway, but I try and inspire them that they can be great researchers and that they have all the skills they need, and not to listen to somebody who says something off the cuff that's just destroying them. And I was told I needed to make a quantum leap to get a PhD. And it stayed with me for about a year until someone said, that was just a stupid comment they threw out there. Why are you letting it destroy you? And so I kind of do a lot of that stuff. I feel, and I actually see them relax. You can see it on their face that they feel better. So that's something where I feel I can really help them. Of course, I can help them with the nuts and bolts of what they're trying to do, but that's where I really like and enjoy the interaction with them. And usually after that, we get on really well, and they are.
And that is definitely something you want to capture as you're describing that because that's a big motivation for you, that identity development and sort of helping them get over that hurdle. It kind of comes to that next question there, which might not have been quite as obvious. When you talk about how you teach, you just described quite a lot of coaching and perhaps a bit of reflection, and fostering reflection and teaching your students on how to reflect and discern a bit. That's definitely something you want to include in there. How do you teach it? I'm sure you give lectures as well. In that large scale group you first mentioned of, yes, I use this as an introduction to research practices. You may use a lot of lecturing, but you really want to highlight, this is what I do one-on-one with these learners who are struggling. How do you teach some of your fellows? How do you teach some of your MS1s?
So we have the structured clinical skills groups, and so usually each week
there's a so we have structured clinical skills sessions, and then each week there's either like a different module on either a organ system that they're learning at the time, or more towards the beginning of MS1 year. It's the basics. Can you do an HMP? What does, a visit look like? And how do you try to think about, asking for review of systems? And how do you approach asking a patient about their social history when you're uncomfortable, and how to make the patient at ease? So there is a structure to follow and kind of that sort of thing. But I think the most rewarding part is just seeing them grow, of like who they were when you first saw them to where they are now.
Oh, yeah, yeah. How about your interns, your fellows specifically? How do you teach your fellows? What techniques or processes do you use?
I don't know how to answer that.
That's all right. That's okay.
Which is your favorite environment? Because I think bedside must be so chaotic, and I think you're amazing being able to teach in a sort of chaotic environment. But I guess that's what ED doctors are about. You never have a non-chaotic environment, right?
Sure.
I feel like one group is much more receptive to me than the other, and so it weighs, like my fellows, like I'm their program director, and they are just soaking up the knowledge, I think, and they act interested, and I have lots of discussions with them, and so it's just different in the it's more of a, they have so many other teachers in the other venues who are maybe more compelling than I am, or maybe are more, maybe they're wrong, maybe they're right, maybe they have a different perspective, and people settle in to a teaching style, so it's kind of.
So I
that's a
will
bit of a tangent.
tell you, no, you did answer though. One of the tools you use is discussion. And that is a structure, that can be a structured tool or unstructured tool, but that is a technique. Let's discuss this problem.
Yeah.
We sometimes don't think about that quite as much, and I suspect you have a few fellows, so it's really more of a small group that you're working with them on. Here's a problem, we're going to discuss it. Maybe you're asking them to present things. I did hear you say earlier, you send them out to do problems or to do tasks. You give them an assignment, have them do it, then we're coming back to it. Those are all those sorts of techniques and options you use.
I mean, I've never publicly admitted this, but I'm going to say it. So when I'm standing in front giving my slides, I'm bored
Sure.
of my content. Are you guys?
Yeah.
Do you guys get that too?
Yeah.
Where you're like,
That's the biggest.
I'm not even interested in presenting a presentation that I wrote.
Right. Do it a couple of times, and then you need, I'm so tortured by the fact I can't do the same thing year after year. It just makes your life so hard, constantly bringing in new stuff because of the boredom of just, I can't even say this again. Like teachers who are just teaching the same thing, I think they must have incredible relationships with their learners to want to give the same information over and over again. But yeah.
I think they have a different motivation for
Yes.
that and how they derive joy from their teaching. And so what I hear is that y'all really enjoy a lot of experiential learning, active learning techniques, which really are the whole premise of how you actually engage learners in solving problems. And so I think there's probably different motivations for those individuals who love giving that same content. I too have, especially when I've had to give 2 lectures back to back to like 2 groups, I'm like, did I actually say this slide already? I can't remember if I've had the discussion.
Yeah.
But I think the other, it's interesting to sit here and talk. I think probably many of us have written a teaching philosophy that we've had to turn in for promotion and never actually really thought deeply about each of these questions. And it's really critical. As you write it up in a narrative format, it's going to look, a lot different, but you have to be able to answer these 5 key questions in order to be able to begin to sit down and write.
Yeah.
And I think we're coming kind of close to the end of our time. The last question on there may take a little more time for people to think about and reflect, and that is, what do I believe about my teaching? And I've, in the handout, sort of in your worksheet, there are a couple of other questions I would add in there as you're sort of thinking about that. What do I think about my role my purpose, my motivation. This is that place where you sit a little bit with those results of your philosophy of adult education inventory and reflect on that. The last question on the worksheet that I encourage people to think about, especially if they are submitting philosophies regularly as they go up for new positions, is to kind of close it out with thinking about what is my next step as an educator? What am I going to learn, do, or try on next in my next role? I think it's a great way to close that. I don't think we have a lot of time right now for discussion for that, but we've included that on the handout as well to think about. Using this philosophy, once you've really fleshed out the answers to all these questions, done a little bit of reflection, can be a great way to define your role and definitely a great way to advocate for yourself if you are looking for new roles or if you're looking for promotion. And the last thing I want to highlight, just if you're looking for good examples, each of these citations, and these are in the slides that are on the app, have some examples that you may find. And again, thank you all so much for showing up. We enjoyed talking with you.